Maybe I got a bit overconfident. After that happened, my confidence was really shaken to the core. After all the work that I had put, after all the feedback that people had given me, after watching people's videos that I recommended to say, I think this would be a pass, and they passed, but I didn't.
In this video, I'm going to share with you the inspiring story of Dr. Fungai. She had a lot of trouble in her preparation, but she didn't lose hope. Welcome on the show, Dr. Fungai. How are you doing?
I'm all right. Thank you, Dr. Erwin, for having me.
Congratulations on passing your exam. How are you feeling?
Woo! I'm feeling excited, relieved. It's such a huge relief. I don't even know how to explain it. Sometimes I feel like, oh, is this real? As I was saying to my trainer the other day, but I'm really excited. Maybe that's just the summary of it.
Share with us your journey in preparing for the MRCGP exam, Fungai.
Initially, to be fair, I did study the exam a lot in terms of what's required, marking schemes and things like that. I recorded many videos over and over again, different cases, and I then watched the videos when I had time, and then tried to improve. And at the end, I tried to select what felt like would have been the best of all of the videos that I had, because I did quite a number of videos. And I would watch them with my trainer, not with some peers as well, maybe in the last few weeks, last 1 or 2 weeks. So I suppose that's what I did, as what would be advised in terms of mandatory criteria and all of that. I just wrote a few things. I'm going to check something. There were some things that were, in terms of like my recordings, I wasn't very specific in terms of like, I'm going to put these cases on my clinic. I'll just say, right, I'm just recording everything. And then sometimes I would have 13 minutes or so, and very complex, a little bit more, and feel like actually it feels like it might be a good one. And maybe saying it feels like is perhaps what contributed to me not passing in the first instance, because it's not about feelings. It's about being objective at that particular point in time, when the recording was done, to someone who doesn't know me, for instance. I also, when I watched with other experienced people and peers, people would give feedback like, lovely man, a lovely doctor, clear rapport. And I suppose I never had any concerns with rapport, and I over focused on that and felt like if it felt good and it looked good, then probably it would get me marks. If I didn't quite put in everything, the manner of the doctor and the rapport indicates that probably they would have talked about that. I mean, the next. So in my first submission, I think that's where I missed it in terms of time management, where time and time again, I got feedback to say, your pace, you need to speed up, because even though you look like you want to ask something, your manner says we've got all the time in the world, but we don't. And so, yeah, so looking back, I mean, when I then rewatched the videos, sometimes it was perhaps a week or two, or whenever I found time after the recording. So you'd find that in terms of what I needed to improve on, some videos had the same things that needed improvement, simply because by the time that I rewatched the video, I wouldn't really have, by the time that I re-recorded a video, I wouldn't have acted on things that I feel like, needed improvement, if that makes sense.
Yeah.
Maybe I got a bit overconfident. What I mean by that is that I was the educational scholar. So I was really involved in the VTS teaching as part of, being a scholar role in particular education. So I'd done like small group facilitation courses, and obviously, preparing for the RCA and working, with the education team. part of that would be to help facilitate those teachings. And I think that in some little way got to my head to feel like I've got this when I should have put a bit more work into it.
Tell us then the frustration and the obstacle that you had with the time management, because it seems to me that you mentioned the pacing was a bit slow as well. What did you do differently to make sure that you're managing your consultation within 12 minutes?
There were quite a few things I had to change. Like when the patient comes in, I remember being told that you need to show that, we are on it, this is what we are doing, and not necessarily say we need to finish in this particular time, but actually plan the consultation, because this is a patient that would have been booked at least a day or two. So I know I've got a menorrhagia case. I know the specific questions that I need to ask. And actually, at our practice, we have got the clinic system where patients fill in their symptoms and they need to automatically appoint the appointment, whether that was with me as a recording session or with any other doctor. So already I had some insight into the cases that were coming. So I prepared better for the cases. I knew that, within the first minute with the timer, I always had the timer, even the first preparation, but this time around, I used it. I actually, when I went to get the patient from the waiting room, I pressed start. So I could see that, the patient has spoken for at least a minute or so. So now I can interrupt in a manner that's polite, but that says, actually we do need to get along with this. That is if they haven't finished what they're saying. That's the first thing. The second thing, so planning. And then I remember, so that was from feedback here at our VTS, and then also when I did the coaching with you, there was what you taught me or coached me with about the pivotal phrase. So that meant that by that time that I should be saying, I think this is, I know you were wondering this, if you have got this, but actually from what you have told me and the examination, I think this is it. At that point, it should be 6 to 7 minutes, so that I've got time to have shared management and discuss with the patient. So that really helped and gave me more time with management. And and I think for most of the cases that I submitted, it meant that things like safety net, saying we've covered a lot of things, what would you like me to go through again? I would have done that. So there's no doubt, in the examiner's mind, what we are doing, the next steps. So yeah, pivotal phrase, pacing myself and just coming across as, we are doing this, and speaking a bit faster and leaning forward, like my body language. Sometimes I would, lean back and say, So people feel like they need to add more, but when I'm actually just sometimes naturally like that. So yeah, so that's what I did.
That's really good insight. Thanks for sharing that. When it came to practice and role plays, what role did that have in your preparation, Fungai?
So the role plays that I did with you, I mean, with my peers, most of them, to be fair, felt like it wasn't for them, that it wasn't really helpful. So I didn't manage to do that with peers. But when I did that with you, that was helpful in showing some mannerisms that took time. Like I would summarize, but not a real summary. So I would say everything that you said. And then that would take like not less than 30 seconds, which is time. So you would stop me and say, you've said too much. There are specific things that you need to pick that you want to follow through. That was helpful. And the role play also helped in bring out things like, when I said earlier that people said lovely manner, I think sometimes if we are not given feedback, we feel like we are okay, like, and we are inclusive. But I used this phrase a lot, bless you, when I didn't have anything to say. And when I was trying to be empathetic. And when you mentioned that not everyone, how can I put it, Chris? Not everyone likes that phrase or identifies with it in a manner that I'm trying to say, oh, I feel sorry for you, it gave me a new light, because it's something that I didn't say a lot before I moved to the UK, but people that I mingled with said it a lot. So then I started to say it, and it kind of felt like it's a full stop or something. So that was helpful to point out things like that, to see myself in a consultation in a way that was a little bit different from the first time, and also to practice saying things, because the cases that we did as role plays were very common, and actually did submit, some of them. So that was helpful to have practiced saying some things, and it comes out more naturally, if that makes sense.
Absolutely, yeah. Other registrars told me as well that the cases that we role played were helpful because they helped the scenarios that they had as well. So tell me about your confidence. How did you build your confidence back, especially after the fact that you thought that you were going to pass it first attempt and then it came as a shock to you?
That's a very difficult question for me to answer, really, because after that happened, my confidence was really shaken to the core. And I felt like after all the work that I'd put, after all the feedback that people had given me, after watching people's videos that I recommended to say, I think this would be a pass, and they passed, but I didn't, I felt like I needed to start from scratch. And I think, in a sense, I did. When I did the coaching with you, and we had this support for exams, sort of one-on-one with our deanery as well. So what helped to build my confidence was to be able to see that perhaps I've completed in about 12 minutes, at the maximum 12 minutes, 30 seconds. So having more consultations, that I'm confident everything is in. And feedback was really helpful, and encouragement to say, actually, you can do this. It's case selection, it's taking on board the feedback and actually applying that and seeing that happen, did help to build the confidence to say that actually not passing the first attempt doesn't mean that I'm not a good enough doctor, that there's always improvement. Even if I had passed the first attempt or the third, it's learning. And I think, as doctors, as GPs, we are always learning. The moment we stop learning, then perhaps we are not doing a good service to our patients and to ourselves. So acknowledging that was helpful. Friends and family. And I remember when we did the first session with you, you asked me what it would look like if I passed. That first interview we did, you might not know how impactful it was. I think I was all tears and sorry, snot at the beginning. But the way you asked, what does that look like? And you made me visualize how, if I see CT, I want my sister to visit. I want to be able to have the independence to do. Seeing that helped me to work towards that. And the more I saw that, the more my confidence improved. And maybe, in a sense, saying, if it doesn't work out, I have another chance. I had to process that, because of the first time. I had to put myself in a headspace of, if it doesn't actually happen again, what am I going to do? So all of those things in combination. I'm not sure if that actually answers, but that's what went on through my mind, and that's what I think.
That's very powerful what you just said. When you have this visualization and you see yourself managing to pass and there is an internal reason for doing it, then it helps you to keep up with the work and driving towards the goal that you've achieved. What were the things that you did in your consultation to get a good structure?
So to get a good structure, we always had this, like we did when we started the consultation models throughout general practice training. There was there's one that's particularly common in the Southwest, in particular in Cornwall, because it was written by a Cornish GP, called the consultation heel. So it's got it sort of like takes a little bit from all of them. But for me, apart from the consultation heel, there's neighbor that I always like the preparation, the handing over, all of those 5 components. And so I had a little picture of a heel that has got at the bottom minute, red flags. At the very top of the heel, I incorporated other things that I learned, like, pivotal phrase. At this point, when I'm going down the hill, I need to have said this and verbalized the diagnosis, if you like, and, said that. And at the very bottom of that hill, I need to have done a safety net. I did change that a little bit because I realized that sometimes I don't always manage to safety net at the end. So there were times that if I asked specific red flags, I would use that opportunity, like for mental health, specific phrases like, well, if that ever happened, there is help and support for you. You can do this. So already I've done the safety net. So at the bottom, it's just referring to say, as I said that time. So having that sort of visual next to the clock, it was a tiny yellow stick. I've got this sticky notes. Just show you like this. So it's very tiny. So it had a tiny heel specific for that consultation next to the clock. So this, as I'm watching that, it's like triggers in my mind. I don't know if that's cheating. Well, so I suppose some people might say it is, but they are visual sort of prompts. It's not like there's medical information or anything, because actually these were real-time consultations, and I wouldn't have anticipated what the patient would have said, but just as a form of a structure, if you like.
It looks to me that you had a clear map of how the consultation were going to play out, and that he'll kind of help you to know where you're at. So in terms of your thought process, as in this time round, you mentioned that there were key things that you did differently. If you had the opportunity to go back and say something to your younger self who were taking this exam just after you found out that you didn't pass, what words of advice would you give to yourself at the time where it was the lowest point?
I would say to myself that it's possible. You can pass this. That you need a bit more structure. You need to watch your videos the day after, so that the following day that you're doing another recording, you need to apply the feedback that you have given to yourself. That you need to be better prepared, because sometimes there are random things that, even though the clinic form says something, there are things that then happen in the consultation that are like curveballs. So you have to be natural in how you are taking that, to show that you're experienced, you've managed this, that you are a safe doctor. So continuing to have knowledge updates, I would say that, and I would say time, and that when you are watching, do mark strictly. The first time I didn't mark per se. I mean, as I said, I got a feeling. But the second time I had sort of like a grid where so this is children's cases, this is mental health, case 1, case 2, case 3. This is a 4 out of 9. I wasn't too liberal in how I marked myself. So I would say put more into it. It is possible. Yeah.
You mentioned you fail, and then the second time you pass it. Do you remember your score, Fungai?
So I think I got the first one, I got 141. I think it was about 9 marks from the pass mark. And now it was 157, I think. So it was actually about 8 marks on top of the pass mark. So it was a significant change. So yeah, I'm really grateful and excited.
In terms of the thought process when you went to decide whether you were going to get coaching? What were the things that went in your mind?
I said to myself, you deserve to give yourself the best chance that you can. And if that means getting extra help, then that's important. There's obviously the cost, the monetary cost. But I thought this exam is really, really expensive. If I can get coaching and have to pay it once, I think that's worthwhile rather than not getting coaching, then having to pay again and then get coaching. In case it doesn't work out, I need to do the SCA. I might as well be as best prepared as I can. So whatever help I could get from the deanery, I took it. And then plus more with the coaching, because sometimes we are all different. Sometimes some people need a bit more support in one thing, and some people need a bit more support in another thing. And as I said, I was the educational scholar, so I was doing a project called Supporting IMGs. And I suppose in a sense, I was like a case in point. I can say that now, the irony of it, but that's how it is. I've not, English is not my first language, so there are some phrases I had to learn to speak, and of course there's the issue of accents and coming across as however I need to come across for the purpose of that consultation and all that. I think acknowledging that needs more work, even for me who thought I could help others. Not who thought I could help others. I mean, I was helping, but perhaps I needed a bit more help myself as well.
You realized that there were needs for you to get some help and you had that awareness. So if you're speaking with someone who's considering coaching, what would you say to that person?
I would say have that first conversation, because for me, this may sound a little bit, when we had that first conversation, it wasn't part of the coaching. It was you said that it was to make sure that we are on the same page, that what I feel I need and what you know you can offer match, so that there's no unmet expectations, if you like. So in retrospect, I view that as, in a sense, a consultation, because I had eyes, and now I know that as doctors, we've got our own eyes, and at the end of the consultation, we've got to meet those two. And I feel like that first meeting we had is an important one to have for anyone who's considering coaching, whether they then end up taking it or not. Because then without having that conversation, you may continue to feel, oh, like, no, I don't need it, it's not for me. But actually you'll be surprised in that conversation and having your mind open to things that you hadn't considered. So I'd really encourage anyone who's considering coaching to say, have that first conversation, because it's not something that you just jump into. You obviously have to consider, what are you expecting, and understand what is being offered and see if that's something for you.
Are you feeling anxious about the SCA preparation? Maybe you're not getting constructive feedback, you don't know whether you're doing the right thing. If you're looking for one-to-one support, I'd love to help you. Click the link down the description below to book a call with me to see how I can help you to pass your exam. Tell us then, what are you looking forward to? You mentioned about your sister earlier.
Yeah. So I'm looking forward to, she's my direct sibling who comes after me. There are lots of us. And she's been wanting to visit. She and her son, Liam, he's turning 1 on the 5th of December. So last year I managed to go to Zimbabwe, but this year I'm not able to because of everything that's been happening. But once I am going to CCT, all being well with finishing portfolio stuff, which most of it is done. I'm going to CCT on the 21st of December. And I have a few possibilities lined up. I might do locum with that visa for IMGs, or if I do agree with an employer, I would then already have, a year and then indefinite leave to remain. But with a year visa, she can apply and then she can come to visit, and I'm really looking forward to that.
Great. I'm really happy that you can now start enjoying and looking forward to doing other things out of training. So thank you very much for sharing your insights with us. It's been really useful to learn from your process and how you managed to bounce up after what's happened. Have you got any final piece of advice for GP trainees who are planning to sit their SC exam?
I would say put in the work, believe in yourself. There was an article that you sent, because I'm receiving every Friday sort of like insights about stuff, which are really helpful. So one of that thing is, yeah, believe in yourself, believe you can do it with all of the help that you have, and work really hard, understand the exam, understand yourself, and you're gonna make it. You're a really good doctor.
If you find that your consultation is going far too long, then you're probably not doing something right in the data gathering or clinical management. It's important that you look at your consultation, audit how you're using your time, and see where you're spending too long, where you can compress your consultation so that you give yourself enough time in clinical management. If you found this video useful, you might want to watch the next video here. Click here to watch it. Take care, everybody. Bye-bye.